Hi, my name is Lynn Frost. I'm the Public Health Nursing Supervisor for Portage County Division of Public Health, and I'm here today to talk to you about overdose fatality review teams, and specifically information about our Portage County OFR team. I serve as the director of our OFR grant that we received from the Department of Health Services, as well as the co-facilitator for our OFR review team. And today I'm going to talk to you a little bit about what overdose fatality review is, what led to the development of our team, the Portage County overdose fatality team and who comprises that, the data collections that we collect, the data information that we collect, confidentiality, what is a part of the death review process, and then recommendations that are generated at the local and state level. So every year, we were seeing kind of increasing numbers in nationally, statewide, and also locally of overdose fatalities. And really that stems from the opioid, the overdose and opioid epidemics that were occurring dating back to 1999 and through 2017, more than 702,000 people died from a drug overdose, and 67,000 died in 2018 alone. And so, and they're leading, drug overdose is a leading cause of death within the United States. And so Portage County was not exempt from this occurring. And so again, I mentioned we have about 8 overdose fatalities per year. And so that really led to the identification of needing a fatality review team. We do have several other review teams currently in place, including child death review and also suicide death review teams as well. So it was an easy transition for us to establish this team, as we had already a lot of community partners engaged in those other review teams. And this really came about because overdoses are identified to be preventable with coordinated prevention strategies, timely implementation of evidence-based interventions, community mobilization, and support of family and friends from the individual. And if you can disrupt certain points that may in the decedent or in an individual's life where a substance is being used, either the substance itself, the location of where they're using. Some of those things are in the support services that they're receiving. Some of those things are known to be prevention measures and actually preventing that overdose from occurring. Again, the purpose of an overdose fatality review team is to really prevent overdose deaths from occurring, strengthen your community partnerships amongst your team members, identify gaps and barriers in services, keeping a pulse on the drug prevalence and trends that are within the community, and develop prevention and intervention strategies. And this is really done through a multidisciplinary team approach, improving and improve organization and community policies and systems. It's another way to honor the decedent's life and the death of that individual, and that they hopefully didn't die for nothing. That this as part of this review process, a recommendation can be generated that will lead to prevention of further deaths in the future, and also helps individuals in the team to develop a deeper understanding of missed opportunities for prevention and intervention that may have prevented the overdose fatality from occurring. As I mentioned, the Portage County is a participant of a grant through the Department of Health Services of Wisconsin, and we are currently in year 4 of that grant cycle. And that helps support operational costs and implementation activities related to overseeing the overdose fatality review team and coordination of the meetings and other information and strategies that we're working on. And the Centers for Disease Control, the CDC, and the Bureau of Justice Assistance have really been leading entities in supporting OFR efforts in the communities. So here's a little bit, here's a makeup of who comprises our Portage County OFR team. As I mentioned, the public health is really the leader in facilitating the team and coordinating the team, but there are a lot of other entities as far as like the social services part of the Health and Human Services, Child Protective Services, We also have members from our EMS and corrections, the district attorney's office, behavioral health, the school districts, Three Bridges Recovery, the medical examiner's office, all three entities of our local law enforcement, justice programs, health systems, and also our Vivint Health partner who oversees our satellite LifePoint program for Portage County, which is a syringe access program. As far as information that's collected and shared within the team, confidentiality is always an essential component of that, and it's security of data. So the information we collect and generate from the review itself is stored in a database through the Wisconsin Department of Health Services. Very limited a number of people have access to that system and the identifiable information that we would record there. We have data sharing agreements amongst our partners and also with the state of Wisconsin. And there's also federal and state legislation that allows that information to be shared among the entities participating in the death review team. Prior to each meeting or during each meeting, prior to discussing the decedent and conducting the review, we have members consent to confidentiality, and that occurs every meeting. And type of information that we ask our team members to collect or report off on include demographics of the individual, the death scene investigation, interventions following the overdose, any history of life circumstances and immediate stressors that were known before the overdose occurred. And all of this information is really helpful in building a picture of the decedent and their life, and again, then leading to recommendations and risk factors, identifying risk factors and recommendations for future prevention. But the the facilitators of the team will send out the information for the cases to be reviewed. We require that all of our cases we review be cleared from any kind of legal investigation so that any proceedings there are closed and finalized, and information we discuss can't be used as part of the investigation itself. Team members then research their agency's involvement with the individual, anything historical or relevant to the overdose. Then we share out information at the review regarding the decedent's life cycle of substance use, comorbidities that may have contributed, major health events, social emotional trauma and adverse childhood experiences or ACEs, encounters with law enforcement and criminal justice, any treatment history they may have had, any local considerations that might be occurring in our community, and trends. And again, this is really for local level recommendations and also state level if that would be generated. But at the local level, we track common risk factors and circumstances, and then that leads to generation of effective data-driven recommendations. And for the state, they can compare risk factors across counties or jurisdictions and also identify how the state might better be able to support the whole for prevention. And so through data, then we gain knowledge, and that leads to action and those actual recommendations or the feet on the ground that are moving these initiatives and recommendations forward. So our Portage County OFR team was established in 2021 with our first review we completed in December. Since then, we have reviewed 8 overdose fatalities, and some of the things that we're finding or trends that are most have been accidental, not intentional. And fentanyl has been a major contributor in almost all of our overdose fatalities through toxicology reporting. The median age of the reviews that we've conducted was 37, and adverse childhood experiences or ACEs were very common. Often alcohol was identified as the first substance of use and often initiated early in adolescence between the 12 and 13-year-old range. So in our first year, we were able to come up with some recommendations and initiatives that we've tried to implement in our community. One of them being the distributing 211 recovery cards during routine traffic stops or interactions with individuals with known or active historical substance use offenses or involvement or anything that would be on the record. Seeking opportunities for grant funding to support implementation of trauma-informed and responsive communities, increasing access to multi-levels of care for individuals with substance use disorder, including inpatient, day treatment, and sober living options, developing sustainable and accessible peer recovery and support services within Portage County, increasing Narcan availability within the community, and implementing next of kin interviewing. And the next of kin interview really has to deal with getting a better picture, maybe more information that we might have from the entities sharing or their records to understand more of maybe those childhood experiences or things that we may not be able to gather for the review normally. And also a way to support those families and individuals that are grieving the loss of that individual. It's a way to support them and provide resources and information, and that little bit extra bit of a connection and care following the death. Overdose fatality routines within Wisconsin don't operate unto their own. There is a collaboration amongst all of us through community partnerships and community practice calls where we can engage one another and see what we're doing within our communities and provide strategies or maybe ideas for change within our community. I know some jurisdictions have Narcan vending machines, or there's different things that are going on in different parts of Wisconsin that are really neat to hear what those communities are doing and generate momentum within our own. So there's also technical support from the Department of Health Services or the Medical College of Wisconsin, who helps guide teams in their development, conducting their reviews and providing supportive resources. So we had a lot of assistance in getting this up and running. If anybody has any questions following listening to this presentation, feel free to reach out to me. My email address is frost, F-R-O-S-T-L, @co.portage.wi.gov. Again, that is frostel@co.portage.wi.gov. Thank you for listening today and have a great day.